Hi, my name is Brittany Chan, and I'm here to talk about Neisseria meningitidis. So, as you can see in the picture on the right, they're little coffee bean shapes. So, they are also gram-negative diplococci, as you can see. In the picture on the left, that you can see there, the little arrows are pointing to it. So, the larger red cells are pus cells, and so the Neisseria meningitidis can be inside or outside of the pus cells. And as you can see from both pictures, there's no spores, so they don't make any endospores. And there's also no cilia or flagella, so they have no way of moving around. They're non-motile. And the common name for Neisseria meningitidis is meningococcus or meningococcal disease. And so the requirements and characteristics for it. So the living requirements for Neisseria meningitidis is they're microaerophilic. As you can see in the test tube, they need oxygen, but they're not at the highest level, so they don't need a lot. So they actually have low oxygen needs. And surprisingly, they have actually high carbon dioxide needs, and they need a lot of moisture in addition to nutritional supplements. And the characteristics of Neisseria meningitidis include so one of the most common diseases that it can cause is meningitis. And as you can see in this picture that I'm pointing to, meningitis is like inflamed meninges and your spinal cord. So that can obviously cause a lot of damage to your brain, such as loss of limbs, hearing loss, seizures, etc. So Neisseria meningitidis also grows on the mucosal surfaces of humans, so your throat and your nose, and so that is the way that it is contracted. It also ferments glucose and maltose, and it grows on chocolate agar plates, as you can see in this bottom right picture. So they're actually blood agar plates, but the red blood cells are partially hemolyzed, and their endotoxins can lead to septic shock. Their LOS proteins can cause leaky capillaries, consumption of platelets, and a large inflammatory response. So Neisseria meningitidis can occur anywhere in the world, but there is a very high occurrence in what is called the African meningitis belt, as you can see in this top right picture. And that's from Senegal, Gambia, Guinea-Bissau, Guinea to Eritrea, Ethiopia, Kenya, Uganda. And there's also been a very recent outbreak in Florida among people who are gay, bisexual, and other males who have had sexual intercourse with males. So keep an eye out for that. And other high-risk individuals include the immunocompromised, infants, teens, young adults, and older adults, including college students who engage in oral sex and sexual intercourse, travelers to sub-Saharan Africa. And the reservoir, as stated earlier, is mucosal surfaces of humans, and they can be transmitted through the exchange of saliva or or spit, sexual or oral intercourse, or sharing drinks. So Neisseria meningitidis, the incubation period for this is usually 3 to 4 days. They can take up to 10. The period of illness is 7 to 10 days in healthy individuals, and the contagious period is, it's like COVID, basically, where it can start during your incubation period, and you can be contagious even though you're not showing signs or symptoms yet. And then it stops being contagious when it's successfully cleared from your system, such as when you're after you take antibiotics, so around like a day after. And the signs and symptoms of it, as you can see from this picture on the right, intense headache, fever, stiff neck, nausea, vomiting, lethargy, or drowsiness. You get like a bruise-like rash, increased sensitivity to light, photophobia, and altered mental status. Excuse me one moment. So, so the signs and symptoms are skin rash and seizures, and they're actually part in 1 out of 10 people, they're carriers of Neisseria meningitidis, and is usually found in the nose and throat as part of their normal flora. So, two of the most common manifestations and their symptoms in the picture to the right is meningococcema, which is blood infection, and meningitis, which is spinal cord and brain infection. So, bacterial meningitis can actually lead to meningococcema, or septicemia, which is infection of the blood. And that can also lead to vomiting, fatigue, dark rash, rapid breathing, diarrhea, severe headaches in the abdomen, muscles, and joints, and your chest. And the purple rash is usually the telltale symptom that you have meningococcema. Unfortunately, even with treatment, 10 to 15 out of 100 people die, and 1 out of 5 are left with serious injuries. And of course, like meningococcal disease, it can lead to infection of the brain. And the brain is a very important part of your body. It controls everything. So that can lead to brain damage, seizures, hearing loss or impairment, arthritis from sexual contact, loss of limbs, nervous system damage, and chronic pain. So how can we prevent Neisseria meningitidis? So preventative measures include prophylaxis, which is ciprofloxacin, if you're in close contact with someone who has meningococcal disease, and taking both meningococcal vaccines, which is actually a requirement. I'm not sure if you need to take both, but I know you need to take one to go to school in addition to like mumps and polio vaccines. And the treatment is ceftriaxone for patients younger than 1 month, penicillin for older than 1 month, and cefotaxime. So that's all. Thank you for listening, and I hope you guys have a great day.